If your feet are going numb from diabetes, you probably think that that's the mild part. The burning isn't the problem. The numbness is just annoying. It's the opposite. The numbness is the most dangerous thing your feet can do. In the next few minutes, I'll show you why and exactly how to protect them. I've spent 30 years seeing patients. The last several have been strictly neuropathy. And the diabetic foot is where I see the most damage that never had to happen. I'm not here to scare you. I'm here to explain one thing most people never get told. By the end of this, you'll understand why your feet go numb first, why the numbness is a real danger, and really what you have a simple daily routine to protect your feet, that you can't always feel the damage happening. Quick note, this is education, not personal medical advice. The numbness and tingling in your feet is not random. It's not starting there just by accident. There's a physical reason why diabetes hits your feet before anything else. Your nerves run on a supply line, and the ones to your feet are the longest in your body. The nerve from your spine to your big toe is longer than any nerve that you have. High blood sugar damages the nerves from the far end inward, so the longest ones usually fail first. That's why it starts in the toes and creeps up like a sock. The feet, usually before the hands. What high blood sugar actually does to the nerves, it starves the tiny blood vessels, and those blood vessels feed the nerve, and it floods it with oxidative stress and inflammation. The nerve loses its insulation and the signal, so it misfires, tingling, burning, and then it goes quiet. The quiet is the numbness. Think of it like the wiring at the far end of a long extension cord fraying first. The outlet is the closest to the source and still works, and the far end goes dark. The distance is the reason. Your feet are simply at the end of the longest line. So that explains why the feet. But here's the part that almost nobody gets told, and it's the reason why this video actually exists. Here's the reframe I want every diabetic patient to hear. Most people think burning is the bad symptom and numbness is really the mild one. In my experience, it's actually the exact opposite. Pain is an alarm. It shows up early. Numbness is the alarm being cut. When you lose feeling in your feet, doctors call it a loss of protective sensation. It means you can step on something and, wear a shoe that gives you a blister and really not feel anything. The injury doesn't hurt, so you don't really need to treat it. The silent chain of events that really comes after an injury is the open wound. That becomes an ulcer, and the ulcer gets infected. And this is the exact path that sends diabetic patients to the ER, and in worst cases, to amputation. So you take each seriously by not panicking. But 1 in 3 people with diabetes believe that a foot ulcer was to blame. About 1 in 5 ulcers leads to lower limb amputation. These are not meant to frighten you. They are the reason that daily habits in the next section are so important. Now for the good news, because this is the whole reason why we make these videos. Almost all of that danger is predictable, and it comes down to a handful of daily habits. If this is already changing like how you think about your feet, hit subscribe. This channel is how I get information to people before it becomes an emergency. And if you have a question about your own situation, drop it in the comments. I actually read them. Here is the routine that I want every diabetic and pre-diabetic patient using. None of this is complicated. It works because it replaces the alarm your nerves can no longer sound. Check your feet every single day. Look at the tops, the soles, and between every toe. In a good light, use a mirror or a phone camera for the bottoms, or ask someone to help you. You are looking for redness, blisters, cuts, calluses, swelling, or any color change. Report anything new fast. Wear shoes that protect really your feet and the things that they can't see. Never go barefoot, even at home, because that's where the most unfelt injuries happen. Check inside your shoes to make sure there's nothing in them, and for pebbles that you might not have noticed. Well-fitting cushioned footwear helps lower ulcer risk. Get the annual monofilament test and ask for it by name. It's a quick, painless test that presses a thin filament against your foot to see if you can still feel it. If you can't feel it, that's loss of protective sensation, and it tells us your risk level. The right question for your provider, really, have we checked whether I can still feel things, whether I have protective sensation in my feet? Blood sugar control. That's important because the environment your nerves live in, it means a lot. It's a landmark trial. Light blood sugar control around the nerve damaged about 60%. Better control will not undo the damage overnight, but it slows the progress down so they don't get worse fast. This is where pre-diabetic viewers really have the most to gain. So if that's you, this is your window. So let me pull all this together, because here's the one thing that I want you to walk away from this. Stop treating numbness as the mild symptom. It's the one that removes your warning system. The daily check is not busy work. It's you doing your job the nerves used to do. Numbness is the reason the danger is silent, which is exactly why a daily look at your feet catches problems before they get big and they're still small. The question to bring to every diabetic visit: are we protecting my feet, not just medicating the symptoms? Numb feet from diabetes, it's not an annoyance. You medicate and forget. The numbness is the real danger because it takes away the pain that would tell you something is wrong. The feet go first because the nerves are the longest. The protection is simple and it's daily. Look at your feet, protect them, wear good shoes, get the monofilament test, and control your blood sugar to really guard your nerves that are still here. Key takeaways for this: diabetes damages the longest nerves first, so the feet go numb before anything else usually. Loss of protective sensation is dangerous because injuries go unfelt, then unnoticed, then infected. A daily foot check, proper footwear, the annual monofilament test, and blood sugar control are your real protection. If you want to understand the specific signs that your neuropathy is advancing, I did a full video on the 7 signs to look for. That's a good one to watch. Really, watch it next. I'll leave the link in here. If your feet burn worse at night on the top and there's numbness, I explain that and the real reason behind it in a separate video because it really deserves its own explanation. If you're dealing with diabetic neuropathy and you want straight answers about protecting your feet and your options, make sure that you subscribe. I'm Dr. Bruce Stevens, and getting this to you before it becomes an emergency is exactly why I'm here.